everything starts with the gut. And I didn't believe them. And now I fully am bought in. I think that's where you have to start with everyone.
Welcome, welcome, welcome. This is another episode of the Hack My Age podcast. And I'm so excited to connect you to Dr. Suzanne Ferre, who is all about peptides. We're going to talk again about peptides. It's been probably a good year since we last did that. But before I tell you a little bit about her in this episode, I want to remind you that today is the last day to get into the Biohacking Menopause membership group to win the Nebu Naturals basket. This is skincare, but it's got astaxanthin in it. You know how crazy I am about that. It is got all natural, totally great oils, and it makes you have this really beautiful glow. I call it makeup less makeup. So it's a $250 basket that we can win. I'll have a link to the Biohacking Menopause membership group there. It's a private membership group for women only. I love the women in there. They're so inspiring. They ask the best questions. And next month, we have another giveaway. Every month, we've got giveaways. We have Primadine, a bottle of my favorite supplement of all time. You know how this is activating autophagy. I've spoken about it before. It's one of those longevity supplements that I just don't ever stop. Now, next month, we also have live Q&As, like as we usually do. We have them with me, and we also have my breathwork sessions where I teach women how to breathe through menopause. And our guest experts are the following. We have Kristen Weitzel, who's going to talk all about breath and cold. She's also a breathwork instructor, and she's a cold therapy instructor as well. She knows a lot about female physiology and how we can use the breath and the cold to mitigate some of our menopause symptoms. And then we have Zach Varkas coming on. He's going to talk about ovarian rejuvenation. Yes, extending the life of our ovaries. And then Panda Lee, she's going to talk about exercise and pain management. She used to be the physio for the Hong Kong Olympic team. And we have Dr. Indra Bharathan, and she is our usual in-house functional medicine doctor to answer all your questions about hormone therapy, menopause, gut health, and so many more things about menopause. And the last guest we have for that month of October is Dr. Prudence Hall. And she's been featured on Oprah Winfrey, and she's a really famous doctor in Los Angeles who's treating women through menopause as well. So go and jump in that group. It's biohacking-menopause/mn biohacking-menopause.mn.co. I'll have a link in the show notes for that. Don't forget to subscribe, rate, and review to the podcast. It's one of those little hinges that swing the big doors and do a lot of good for us. So Apple Podcast or Spotify, we'd love to hear your review. And subscribe to the newsletter too. Just go to hackmyage.com and you're going to get all of the updates. Now let's get to Suzanne, Dr. Suzanne Ferre in this episode. I learned about her from my biohacking bestie, Natalie Nidham. I was talking about her a lot lately, and she had a great episode because Natalie is all about peptides. And Dr. Suzanne Ferre, she's into functional medicine and she's menopause and hormones, but she's also a peptide queen. And we took a really deep dive into the peptides in this episode. And she's going to talk about her favorite ones for menopause and some of our symptoms like weight gain and aging skin and thinning hair. And she also really surprised me with her alternatives to the weight loss peptides like Ozempic. And if you want to meet Dr. Ferre in person, you can visit her at Vine Medical Associates in Atlanta, Georgia, where she's the senior physician. She's a double board certified doctor in family medicine, anti-aging, and regenerative medicine. Like, this is a dream doctor. And she's so good at what she does. She teaches other medical students and residents at Emory University. And she's on the faculty of the A4M, IPS, ACAM, SSRP. These are just short for amazing and big names in the anti-aging, or I hate that word, anti-aging, just the aging and longevity space. And maybe you'll recognize her voice or her face if you're on YouTube, because Dr. Ferre has been featured on Fox TV and ABC News. And in her practice, she loves to use bioidentical hormones, peptide therapy, neural therapy, and regenerative medicine to treat her patients who've got all kinds of things from endocrine, mitochondrial, infectious, autoimmune, and neurodegenerative diseases. And she's got a thriving practice. And she also recently launched a book called Counterclockwise, Using Peptides to Renew, Rejuvenate, and Rediscover. So before we get into the show, we have to read the little disclaimer that this podcast interview contains opinions and ideas which Dr. Suzanne Ferre has formed based on her experience treating patients. It is intended to provide helpful general information on the subjects it addresses. It is not in any way a substitute for the advice of a physician or physicians or other medical professionals based on one's own medical conditions, symptoms, or concerns. And if the listener needs personal medical health, dietary, exercise, or other assistance or advice, the listener should consult a competent physician or other qualified healthcare professional. Both herself and those appearing on this podcast, I guess it would be me, specifically disclaim all responsibility for injury, damage, or loss that the listener may incur as a direct or indirect consequence of following any directions or suggestions given in this podcast, using any products or services described in this podcast, or participating in any programs described in this podcast. Woo! That was a long one. So now let's get started with the show. All right. So it's a pleasure to meet Suzanne Ferre, Dr. Suzanne Ferre. Welcome.
Thank you so much, Dora, for having me. I'm excited to see you today.
Now, let's talk about in your practice, because you've got so much experience and you're surely treating women going through the menopause transition. I'd love to know, what are their biggest complaints? And then how are you treating them?
Well, of course, I think the biggest complaint I see in general is fatigue. But of course, I think in menopausal women, that's a big, big factor. And I think lots of things play into that. We have to realize that although menopause is typically a decline in estrogen and progesterone, what we often will also see at the same time is an increase in cortisol and a decrease in DHEA. DHEA is one of the sort of grandma hormones that becomes testosterone and estrogen later as it's metabolized in the body, but it's produced by the adrenal glands. And so we'll see that a lot of these menopausal women will have, because they're moms, a lot of them, and they're children, adult children of elderly parents, would get that sort of sandwich area. And now we're dealing with this high cortisol. So one of the things that cortisol does is binds to a lot of our hormonal receptors. So you could have plenty of hormones laying around, but those receptors are blocked by the estrogen, by the cortisol that's circulating and giving you so much trouble. And so the receptors don't work quite as well, and people are feeling really fatigued. Of course, things you would expect: hot flashes, night sweats. One of the things you'll not sort of think through, that might not be initially obvious, would be gaining weight around the middle, increasing sagging of the face, a sense of depression, and often in that perimenopausal period, which is that 35 to 50 kind of age range, where the ovaries are still trying to keep up with the demand, we'll start to see people have a sort of a brain fog, and then they'll also experience around their menstrual cycles these migraines that occur immediately before. And this is not so much because of a lower level of estrogen as it is because of a rapid decline in estrogen that occurs particularly around the menstrual cycle. So we can fix that with lots of different things, but it's that super decline. Even if you're starting from normal, if you will start to see that decline right around your cycle. So people will get migraines. The other thing we'll see is women will lose their libido, but we'll also see an increase in libido around the time of ovulation, which is wonderful. The reason for that is because your testosterone stays around the same. It's one of the last ones to decline, hormones to decline. And so you'll see that testosterone stay the same, but as the estrogen goes down, it's the only one present. So, wow, I'm 40 years old and I have a great libido. This is wonderful. So we'll see that happen a lot in women. They'll also see breast tenderness or swelling or enlargement. And that's usually because of the decline in progesterone, which is one of the first symptoms of menopause, is that decline in progesterone. So a relative decrease in progesterone to estrogen.
Interesting. Yeah. So we're talking about the perimenopausal woman. And so she may be still ovulating as well. And then it can get so wonky. And I'm really glad that you mentioned that these women are the sandwich generation, right? It's not just the hormones. It's a lot of stuff that's been accumulating over time. And now you've got your kids who are maybe trying to, spread their wings, or maybe they're not. And then you've got your parents you're trying to take care of. So there is still stress. And that's whether you have hormones or don't have hormones, or you're a man or a woman, this can cause fatigue. This can be a problem. And then add on the loss of hormones or the fluctuating hormones on top of it, you see how it's so multifactorial, because sometimes women come to me like that. Is it hormones or is it my life? And I'm like, well, what's going on in your life? And then you're kind of like, well, I think it's both. It's both. And it just seems to be that we're able to, perhaps it's the resilience that we seem to lose. That's why some women get confused. I used to be able to handle stress much better. I used to be handled certain things, and it seems like right now I'm breaking down, not handling it. And and that can maybe be the hormonal part that we can easily fix, right?
Right, exactly. Don't forget about, of course, we add into that all the things you just talked about. We add into that the milieu of toxic soup that we find ourselves in. I would say, particularly in the US, you're in a little bit better situation where you are, but the Roundup and the herbicides and pesticides that we come across in general, the bromine that's used as a fire retardant on clothing and furniture and new mattresses and all the things so there's all these environmental toxins, the water that's contaminated, that's ubiquitously contaminated with toxins. And so being able to release all of those and seeing a functional medicine doctor that has knowledge of how to help you with that detox process can be really helpful, because otherwise, I always tell patients, if you're not moving your bowels, you're not taking your hormones, because I don't want you on them if you can't clear things out. We've got to be able to process things and clear them out.
That's a really good point, that most doctors wouldn't ask their patients if they're prescribing hormone therapy. And it's such an important point. How can you give a woman this and not detox from it as well? And so I'm really glad you meant that approach. So let's say a woman, one of the biggest complaints is fatigue. And I hear this too. This is why I created a program called the Energy Reboot Program. And we talked all about fatigue, root causes, what it could be, try to send women down rabbit holes to go figure out what it actually is. And it can be so many things. So how do you approach a woman who comes in, she's in her perimenopausal phase, and she's like really tired? Are there certain questions you ask? What's the protocol? You say, okay, let's fix the gut first and then we'll do the hormones, or like, how are you approaching this?
Yep. I think our naturopathic colleagues have done such a better job of this. And I remember them talking to me years ago saying, hey, we need to start with the gut. Everything starts with the gut. And I didn't believe them. And now I fully am bought in. I think that's where you have to start with everyone. What's happening? How are you moving your bowels? Not only are you moving them every day, but what's the process? Do you also have some symptoms along with that? Reflux, heartburn, bloating, extra flatulence, all those sort of things. I think they all need to be addressed. And, there's a simple blood test you can do. TMAO gives you just a good idea of if there's anything going on. But the even more simple blood test that we like to do here in the office is just an alkaline phosphatase. In general, a slight elevation in alkaline phosphatase, like more than 60, really lets us know there's some sort of gut inflammation going on, allergy, inflammation in general. So this is on a $3 complete metabolic panel. You can get an alkaline phosphatase. So simple, and gives you it's not a perfect test. It doesn't give us, it's not very strictly only due to intestinal function. But if you have a patient sitting in front of you who's fatigued and has intestinal symptoms, and you get a CMP and it has the alkaline phosphatase level on it, I think that's a really great way for us to simply check to see what's happening there. And then you can branch off from there, looking at other facets of their health. So you can look at their lymphocyte count to be sure that their immune system is not aging rapidly and that they're able to function well in general with that. Then, of course, you can do all their hormone testing, however you proceed to do that. I like to ask patients a lot of questions. So my visits are usually like hour and a half, 2 hours. And we like to go through a lot of questions. We go through toxic load, we go through exposures, things like tick bites. Do you live on a basement in your house? Is it, here in Georgia, we have a lot of water damaged buildings. I think on average in the US, it's about 50% of buildings are water damaged. I think in
Wow.
Georgia, it's way more than that because of so much rain. We get so much rainfall. And we're close to the coast. So I think we get a lot of extra water damage that other people don't. So mold exposure, et cetera. And then we've started to see the CDC is documenting the ticks are moving into Georgia. We're getting a lot more Lyme disease diagnosed in this area. So we have to look for all of that because all of that's going to contribute and affect the way that your body is able to tolerate hormones. So the first thing is a questionnaire about symptoms. And then the second thing would be exposures. And then we would talk to them about how do we make some lifestyle modifications, making sure that they're doing what they need to do, exercise, sleeping, et cetera. What are their general activity levels and what is in their diet? So we go through all of that in their visits to try to get exactly the prescription that they might need, beginning with intestinal function and proceeding through things like immune system, et cetera, that might be beneficial for helping their body to tolerate the hormones that we're going to replace.
I love that test that you mentioned. You mean we don't need to spend $500-600 on a gut microbiome test? Like, that's incredible. What I'm gonna get the name of this one and take it. I wonder if Europe is that kind of a standard test? Because I haven't seen that on the general panel here in Spain.
Yes, it's a pretty standard in the US, we call it a complete metabolic panel. So
okay.
in just the basic metabolic panel that includes some liver tests, one of them it's AST, ALT, and alkaline phosphatase. And so it comes like on a $3 test. It's, again, not a perfect test, but it's a really good sort of lead you down. Now, if you have intestine problems and your symptoms and you're having this alkaline phosphatase elevated, now I might go and do that $500 test, but I'm not going to go that direction if their alk phos is completely normal and they have no symptoms.
What about the person who doesn't she doesn't report any bloating, no gut issues? I've heard gut specialists say, well, just because you don't feel it doesn't mean that your gut's perfect. What is your approach?
I think that's somewhat true. I think we need to look at things. Don't forget about the teeth. The teeth are critical and they are part of the intestinal system. So if you've had a root canal, if they've had especially root canals, that's really the big culprit. And we treat those with neural therapy and then we'll move them along to doing whatever else needs to be done. But that's one of the places to start. I do like to do some sort of, it depends on if they're moving their bowels every day. So if they are, fine, great. If they're not, I really do like to do something to help them move their bowels every day if they're going to go on hormones. I just think it's the safest way.
What's your favorite way to get the bowels going?
I like the perk powder that has magnesium, vitamin C. I think that's a great combo. And so they do the perk cleanse at the beginning, and then they do 70% of whatever dose was required for the cleanse on a daily basis until they start seeing loose bowels, and then they decrease that again. It's particularly effective. You could do very, very simply some magnesium. You could do vitamin C itself. Both of those in high enough doses will move bowels. So people don't usually take a high enough dose to make that happen because it's unpleasant. But that's why I like the powder, because you can put it in water. It sort of tastes like a Perrier.
Interesting. A perk. What do you say? Perk what?
Powder.
Perk
I
powder.
think it's called Perk Potent C.
Okay, I'm gonna get that one. Interesting. So that I'm assuming that's also in addition to, okay, let's get moving, we get some exercise, drink your water, and make sure you get your rich fruits and vegetables. Yeah, your fiber and manage your stress and all that.
Yeah.
So, but I think too often than not, I meet people who can get only like 50% of that. They're like, I'm trying, I can't, I'm doing my best. So maybe they do some of it, but not all of it. And that's maybe when you want to bring in some powders and magnesium and all those things. So that's a really cool hack. I'm going to look that one up. So I could talk to you about many things, because you are so knowledgeable. And I think we're going to have to do a couple episodes here, but I've been listening to you on Natalie Needham's podcast, Longevity, and you're an expert in peptides too. and they can do so much for us. And I love them. It seems like once a year I do a podcast on peptides. I don't dive into it like Natalie, but I've learned that it can help our muscle. We can grow hair. We can soften our wrinkles. We can sleep better. We can do so many things. Let's reintroduce, like, what are peptides? And then what are the kinds that you're using to treat some of the women in going through the perimenopause transition?
Sure. Yeah. So peptides are made by your body. That's the most exciting thing. These are things that your body is familiar with. So it's not a foreign substance that you're introducing typically. Sometimes they've been modified a little bit to allow the body to hold on to it for longer. So, but it's typically made by the body, so it's familiar to you. So these, if you think about a protein like chicken, for example, those proteins are at least 150 amino acids long. What are amino acids? They're those little teeny building blocks that make all the proteins that do all the jobs our bodies need. So enzymes for digestion, anything that's going to help you to make energy in your mitochondria is going to require amino acids. So all the proteins that are made in your body, once they're broken down into smaller pieces, by convention, we call the ones that are 50 or less amino acids in length, those are called peptides. Ones that are 4 or less amino acids in length, we call those bioregulator peptides. Like, for example, GHK-Cu is a 3 amino acid bioregulator peptide. Those are specific because they're often able to be taken by mouth, and they're able to cross into the nucleus and affect the way that DNA is transcribed in a more youthful way. So that's very exciting that we have that opportunity to us. These have been discovered since the 1920s. We've had them, knowledge about the peptides and the presence of them for many, many years. The original researcher, Dr. Pavlov, we're all familiar with from the dog studies, the salivating dog to the bell studies. But those were actually done trying to discover what intestinal peptides were present. And so that's what he was studying when he was looking at the saliva in dogs. Mm-hmm. And so that was one of the original researchers in this area. The most familiar peptides, people probably know oxytocin, which is what we give that IV to our pregnant mommies who are delivering to get them to move along their transition into labor. We also use insulin as a familiar peptide, growth hormone is a familiar peptide. Things like bacitracin ointment is a peptide, and losartan, the blood pressure medicine, is a peptide. So very exciting. There's all kinds of things out there that are available that So these are familiar things to us. But the ones that are less familiar, we've just in the last maybe 15 years come up with a way to create these in a lab that you can mass produce them. Because before that, we either had to take them from a cow or a pig or a human from drawing blood from them and then spin it down and give it back to other people. Now we can actually create these synthetically in a lab in the exact amino acid sequence that your body makes. So that's very exciting that we're able to. So if you feel like you just started hearing about peptides all the time, it's because the technology to mass produce them has just become available to us, even though they've been around, or at least we've known about them for since about a century now.
If I remember correctly, in some of the episodes I recorded, the difference between synthetic and then this was quote unquote natural, which, I don't like using that word, but coming from an animal or a human, it's not like, oh, one good, one bad. I understood that the synthetic ones, they're maybe faster acting, but the natural ones were slower, but longer lasting. Is that hold true, or is that just bioregulators?
When you're specifically talking about bioregulators, you are dead on, because there's a difference in the bioregulators. Some of them will actually take the entire organ. So let's say the thymus gland bioregulator, they're going to take the entire thymus gland organ, which is going to contain all of the cofactors, all of the nutrients like zinc that might be required to make those peptides work. All of that will be included, as opposed to the synthetic, which is just purely the peptide alone. the difference with the regular peptides is that most of them are synthetic. There are a few that are natural. For example, Sermorelin is one that's about 40 something amino acids long. I forget how many, but it's in the 40s range of amino acids. It was taken directly from, I believe it's porcine. It's a pig. I can't remember if it's porcine or bovine right now, but but it was taken directly from originally rather than being synthesized in a lab. Again, that's more difficult to obtain because you have to have the live animals versus if you can make it in a lab, they work great. So,
so what are the three most useful peptides for menopause?
So probably my favorite is anything that's going to be a growth hormone secretagogue. We miss a lot of that as we age, and we know based on research that people will age more rapidly and are more likely to die from all causes if their growth hormone level is low. So we certainly want to do some sort of growth hormone secretagogue. I don't personally prescribe growth hormone directly because it can be overdosed. Whereas if you overdose a growth hormone secretagogue, it just will it'll be wasted. You won't actually be able to do anything differently. And you can't overdose on the secretagogue. So I really like them. They elevate your ability to make growth hormone. So you're, as you go. And I think what's really cool is they also help with increasing your own production of estrogen, progesterone, testosterone. So we're naturally raising our own hormonal levels by triggering that pituitary gland to do its job. So I really love that about using the growth hormone secretagogues. Also, one of the problems we run into perimenopausally is increased percent body fat, decreased muscle mass. Part of that is lifestyle, of course, but part of that is the perimenopausal period. And so if we can take one of those growth hormone secretagogues, we can definitely see a difference in people's body composition. Maybe your pounds on the scale, the absolute number doesn't change, but their waistline will shrink, their muscle mass will be maintained, or maybe even grow if you're doing a higher protein diet and a resistance training program. We'll actually see you gain muscle mass, but at very minimum, we'll see you not lose muscle mass when you're taking something like that. And this is particularly important for women in that perimenopausal period, that we protect their muscle mass because it's so easy for them to lose muscle mass in that phase.
So the growth hormone secretagogues is your number one for perimenopause or menopause. And
yes.
When you say growth hormone secretagogues, is that an umbrella term for several different types, or what are the differences of whatever's available?
Sure. So less are available now. The FDA has made a big pitch in the last couple of years, not because of safety or efficacy, but because they just decided that compounding pharmacies are no longer allowed to compound these peptides. So the ones that are available through compounding pharmacies are Tessamorelin, which is one of my favorites. I really am a big fan of Tessamorelin. It is FDA approved for HIV lipodystrophy, which is a fat wasting disease that occurs in HIV patients. But interesting, it has lots of research in lowering cholesterol, in changing body composition, et cetera. So this is one of the reasons why I like it. It is longer acting. It has a higher effect on patients' growth hormone levels. So based on what their baseline growth hormone level is when I first see them, I might choose Tessamorelin as their first choice. The second choice that's also still available through compounding pharmacies is Sermorelin. Sermorelin is a peptide that also is a growth hormone secretagogue. It's a little bit shorter acting and has to be taken more than once a day. It also requires fasting when you take it. But it is also very effective, and patients do really well with taking Sermorelin. If their levels are a little bit higher when I get a first baseline, then I might start with Sermorelin and we'll just see how they do as they go, because they might not need quite the bump that Tessamorelin would give them. So that's a great option. What previously was available was Ipamorelin, which is actually a ghrelin agonist, and that we often will use in combination with Tessamorelin, Sermorelin. And I really like that combination if we can find Ipamorelin. In fact, in some women, they do really well with Ipamorelin alone, and we don't require them to do anything else. This does not raise their appetite like a lot of the ghrelin agonists can do. So it's one of the reasons why I really like Ipamorelin in conjunction with one of the other growth hormone secretagogues. So it's just a little bit harder to find from compounding pharmacies right now because of the recent FDA ruling about them. Again, the FDA ruling was not due to safety or efficacy. So just keep that in mind as you're doing your research.
So to give people an idea, these are all new words for you. Don't worry. We can have this transcribed and you can write this all down. They may not know these are injectables, right? These are things that you get a little vial, you get your little needle, and then you inject yourself, sometimes daily, sometimes weekly, depends on what it is. With the growth hormone secretagogues, is there a general, like mostly time it's once a week, or what is it generally for how long?
In general, it's 5 days per week. That would be the max dose. And you want to take a break on Saturday and Sunday just to give that's what I tell my patients, just to give your receptors a little bit of a break. I train 4 days a week. So I will just take it for those 4 days that I train, and I take a rest on the other days, just because I'm doing other peptides, other treatments on those days. And so I do take a rest the midweek and then the weekend as well. But the recommended dosing for athletes is a 4 to 5 day a week. Even up to 6, I wouldn't do more than that because of the risk, we want to really give those receptors a rest day. So we'll do 5 days a week, typically, injections. These are the tiniest little itty bitty needles. We usually will teach you in the office how to do that. It's very simple. I think with the Ozempic craze that's happened recently, people are getting more and more comfortable with administering their own peptides. There is lots of research right now into technologies that will allow us to administer these orally or transdermally, meaning through a topical cream or a patch or lots of other ways. And so stay tuned, because all of those are coming our way very soon.
That would be amazing, because who wants to inject? I know you get used to it after a while, but you do get tired. So if you're injecting yourself, say 5 times a week, and take 2 days off, how long until somebody can see a difference? And how long do they have to take this, or how many weeks do they have to do before they start feeling or seeing a difference?
I usually say about 6 weeks. So I think that's a really good way for you to get a good idea of what's happening. If the full effect won't be for 6 months, but you should see something different then. Now, if you're laying on your sofa eating bonbons, you're probably going to see it's going to take a lot longer for you to see an effect, and you may not see an effect at all. But this is a really great way, as you were talking about before. I think the most benefit that I see with this is that resilience, that post-workout fatigue and muscle aches that a lot of us get as we approach menopause. That's really where I think we see the biggest bang for your buck, is that you're going to recover faster and be able to get back to functioning faster. So that improved resilience. I love your word choice there.
Fantastic. Okay. And then is this for life, for a couple of years, for how long? People do cycle it in, cycle it out? How does that work?
So I try to tell people I try to cycle all the peptides. So I'll do 3 or 4 months of that, and then we'll switch over based on what all the things that are happening in their lives. So this is very unique, individual dependent treatment regimens that we prescribe. I see my clients every 3 to 4 months, and we'll go over what's happening in their life right now, what's the changes, because life happens, right? So we all need to be making adjustments based on what's happening in our lives. I have a few patients that will get a little bit of hand swelling when they use Tessamorelin specifically on a consistent basis. And so we'll dial down that dose, or we'll switch them over to Sermorelin, or we'll just change it up altogether, and we'll be doing some repair peptides, some intestinal peptides, and then we'll go back to the growth hormone secretagogues at another time. I do think there's so much evidence that being on these probably for as long as you want to stay young and healthy is a really good choice. The time when you'll need to come off of them is if ever you develop an active cancer. Now, these growth hormone secretagogues do not cause cancer, but if you were to have a cancer, they may cause that cancer to grow. So just be aware that this is not indicated for a person who has an active cancer.
Yeah, well, yeah, they're all called growth hormone, right? So it's promoting growth, and we like to have growth in certain areas and maybe not so much in another. So I'm glad you mentioned, you kind of approached some of the challenges women have with body composition through building more muscle or having, having more strength and that approach. And I really like that much better than, okay, let's lose some weight or let's burn some fat. But there are the peptides like the GLP-1 agonists, the semaglutides that have gone crazy. People love them. They're weight loss peptides. In case anybody doesn't know any of the words I said before, you inject yourself just like any other peptide. What are your thoughts on those peptides? Where do you
So I'm a
stand?
huge fan. I see them so successful. We have lots of patients who I have a patient who went through gastric bypass surgery and a gastric band on top of her gastric bypass surgery. And the only way she lost weight was to go on the GLP-1 agonist. That was it. I mean, she lost like 100 pounds. It was dramatic. And she's doing really, really well now. There's lots of things that we know. People talk about Ozempic face with this sort of sagging of the face. It's one of the reasons why I love having patients on growth hormone secretagogues, because I really feel like that helps to decrease a lot of the side effects that can occur due to the GLP-1s. These are intended in your body naturally, the GLP-1 agonists, or the GLP-1s themselves are intended to be there for seconds and then gone. The GLP-1 agonists that are available, like semaglutide, tirzepatide, et cetera, these are modified peptides that are designed to stay around in the body longer than the natural peptide does. And so that is not without complications. The reason why God designed us to have this just be around a short time is because he didn't want us to have saggy faces until we had to. So with us doing this injectable that it stays around for longer, yay, it helps with losing percent body fat, particularly that toxic visceral fat. Then I usually say your waistline dimensions. We'll lose that with the GLP-1s typically, but the additional side effects are unpleasant. So some people will have insomnia. Some people will have constipation. So we've already talked about how important bowel movement and intestinal function is. So just as you're thinking about this is not for everyone. My experience also has been that 20% of the population who are sensitive to mold and Lyme disease that are particularly ill as a result, also those patients who are long COVID, patients who deal with this disease state, often those people don't respond to the GLP-1s because their body is in this metabolic slowdown in general. And it's as related to the toxic exposure, the Lyme or the mold or the viral infection. And so because of that, they're not going to be as responsive to the GLP-1s. Now, sometimes if you put patients on a growth hormone secretagogue, that will upregulate their GLP-1 receptors, and now their GLP-1s work. So there are those tricky few patients who don't respond to the GLP-1 agonists, and there are a few things we can do in our practice that we do to help with moving patients beyond that rough, sort of slow start of using a GLP-1.
It's such an interesting approach. I personally, the weight loss peptides are amazingly effective. And the problems that I see that are happening as women, they're not eating at all, or not eating enough. They're not getting their protein in because you don't have an appetite. So the things that can go wrong, I think personally, if there could be great if they're given with a protocol to follow and you go through it and you do all the right things. I just see too many people failing. They're like, oh, I can eat all the donuts I want and I'm not still losing weight. Haha. You're like, well, maybe that's not the time to, now is probably a good time to try to dial in the diet. So there's things that can go wrong. And you always say these two camps, people who love them or people who hate them. And I'm somewhere in between where I can see the problems, but there are solutions. But it seems as though the growth hormone secretagogues are kind of a better way to me to approach things. You can still get a lot out of it, but perhaps maybe if you're obese and you really need to lose a lot of weight, I don't know if it's better to go with the weight loss peptides. And this one, I'm sure there are different cases for different people. But let's talk about somebody who wants to lose, or a woman wants to lose 10 or 20 pounds. And this is where these kind of women get a lot of a bad rap, because they're maybe using the weight loss peptides and people think, oh, you're cheating, or it's like a too easy way and you're not doing the work. And some of them are, some of them aren't, I'm sure. But if you get a woman who maybe doesn't want to lose that much, maybe 10 or 20 pounds, which one would you recommend? The semaglutides or the growth hormone secretagogues?
Well, they're unlikely to lose pounds on the scale with the growth hormone secretagogue. So realize what you're going to really see, especially if you are eating adequate nutrients and you're doing resistance exercise, you're more likely to see percent body fat loss, percent muscle mass gain, and about the same pounds on the scale. So you're going to like how you look, because you'll see that, the muscles will stand out because of the fat loss. You'll have a better physique. The difference will be you'll have a little bit of muscle mass gain. And keep in mind, muscle is so important for us as we age, like especially in that perimenopausal period. There are so many reasons for us to do some sort of resistance training as we approach and enter menopause. So the exercising muscle, just doing a bicep curl, that exercising muscle is now producing our own chemical messengers that tell your cells, this is a young, healthy person. Let's produce proteins as though she were young and healthy. If you stop doing resistance exercise, you are likely to age more rapidly. So one of the things we are diligent about doing is monitoring patients as they're on the GLP-1s for muscle mass loss. We tell them up ahead of time, if you lose muscle mass, we're going to stop this, because it's not worth you being on if you're going to lose muscle mass. That's not what this is intended for. I don't want to watch you progress in aging, because that is what could happen. If you are taking adequate nutrients and you are resistance training, those GLP-1s can be magical and be really, really helpful with getting you past. So let's say you have a gummy bear craving or whatever. We're just going to make that up. You have a gummy bear craving and you want to change your body composition, do the things. You should be able to, that GLP-1 agonist should help with that gummy bear craving, whatever that thing is. What people talk about is it quiets that conversation in your brain about having to get that thing that they crave, whatever it is that they're craving. So you're not sitting at your desk trying to work and your body's going, I'm hungry, I'm hungry, I'm hungry, I'm hungry. Come feed me, feed me, feed me. Eat when you just ate lunch 30 minutes ago. So that may be an issue you need to address with intestinal function. And that's another discussion for another time. But also the GLP-1s can really be helpful in maintaining that sense of fullness until your next meal. Mm-hmm. We're going to dose that so that you do maintain some degree of appetite so that you can eat your meals, but not, so it's a very individual dependent dosing. It's one of the reasons why I love compounded versions, because I don't have to go with the 0.25, 0.5, 0.75, 1 milligram. I don't have to use the standard dosing. I can do 0.6287 milligrams if I want with using the compounded versions. And so, there's a plus or minuses to all of them, and insurance will often cover the GLP-1s for the right reasons. But I do really like to be able to specify that dosing for each patient so that they're not losing muscle mass.
That's so important. That's what I see. You can't, we need, we talk a lot about resistance training, like you said, but you still got to eat your protein. I still see women who are, I'm training, I'm doing everything. And they train in a fasted state. They don't eat very much and they're not getting in the protein. It drives me nuts. And the only thing that builds muscle is the protein. The fats don't do it. Carbs don't do it. We need the protein. So we need both. So it's great tonight. It's nice to know that we have all these extra tools like the growth hormone secretagogues or the GLP-1 agonists and on top of an already healthy diet and lifestyle when things are really getting crazy, because none of us is perfect, right? You can give the recipe. We all know what to do. But who does it, honestly? And I think if anybody did it 100%, that's probably orthorexic and not good for them either. So you've got to find some balance somewhere. But let's move on. I want to, well, first, before I move on, are there any peptides for hot flashes yet?
So there are some coming down the pike. I'm not sure exactly that I love the mechanism of action, but what I love is one called Gonadorelin. It's one of the ones by the FDA that's been moved off the compoundable list. But if you can get Gonadorelin, there are a few that still make it, and it will cause your brain to produce its own, your body to produce its own growth hormone. Estrogen, progesterone, testosterone. So love Gonadorelin. It's effective in men and women. And it's used now in many cases for infertility, but we can use it for helping women in that perimenopausal phase. So there's a specific dosing schedule that needs to be followed, but it can be really effective.
Gonadorelin. So if a woman is post-menopause, totally lost all her hormones already, could she take Gonadorelin? Her body will suddenly like jumpstart hormones again?
Probably not. If she's been several years post-menopause. So this is really a perimenopausal 35 to 45, maybe even pushing 50, 52. Remember, average woman goes through menopause at age 52. So we're looking somewhere in that range. And most of us begin at age 35 to lose some of our hormones.
And it's not going to put too much pressure, let's say, on the adrenals or the rest of the body. Because, right, we know when our ovaries start to shut down, then the adrenals take over for creating our hormones. And then they're already taxed with 50 years of life happening. And so that's why we have all, that many of us have these problems. So I'm wondering if you were trying to keep pressuring the body to do it. I'm just comparing it to maybe say hormone therapy, where you just kind of add it in, the body doesn't have to do anything. Is there any differences that you see? Well, let's try to make the body, is that not too taxing versus, oh, let's just put on a cream and give it to her.
I think it's not, especially if it's used in that perimenopausal period, that still having regular cycles, but we just want to kind of boost up that ability of the ovaries to continue producing. So all you're trying to do is squeeze out the last remnants of ovarian function that you can in these patients. And so it's one of the things that they use in infertility treatments all the time for that very same purpose. You're going to get most of the effect from the ovaries.
Oh, okay. So it's coming from the ovaries. Nothing to do with the adrenals then. So you're still like squeezing it out the last bits. So then what about peptides? Can peptides ever do more harm than good?
So I would say specifically in the case of cancer, certainly cancer patients can have trouble. I think if you overdo some of the growth hormone secretagogues, and probably that would be more difficult. People are going to end up with like a carpal tunnel or a hand swelling. We'll see patients do that. They'll have that. If you're taking it daily, you're going to just burn out those receptors. It'll be a waste of your money. So yes, in that regard, it can be overdone. Most of the time, these are taxing on your wallet only. So there's very, very few side effects because they're very similar to what our bodies already make.
Yeah, that makes sense. Let's go on to a peptide that I really wanted to talk to you about. It's a copper peptide called GHK-Cu. And I heard you talking about it before on other podcasts. And I think it's something really great for a lot of things. But what keeps attracting me, I keep hearing, is the skin, and then also scars, because I'm going to go through a surgery. And I also want to make sure that the scar heals well. So tell us a little bit about GHK-Cu.
Yep. So it's one of my favorites because of that. So the Cu part is the copper. The GHK is the 3 amino acids that make it up. It is one of the bioregulator amino peptides. And so we know that although it helps to deliver copper, it's a copper chelator, meaning it binds to and holds on to copper and then delivers that copper to wherever it's needed in the body. But that's not its primary mechanism of action. Although copper is required for collagen production, its primary mechanism of action is going into the cell, particularly those fibroblasts, which are our stem cells in our skin, and making them more stem-like, meaning making them more youthful in their DNA expression. So we have all the DNA for our entire lives in our nucleus, and some of it is youthful DNA and some of it is aging DNA. So we turn off or spool up on these little spools our DNA that's more youthful, because why would an 80-year-old need how to make ovaries, how to make estrogen? They don't do that anymore. So we're just in general sort of trying to keep us energy efficient. Well, if we instead have this GHK on the cell, we know that the proteins that are produced in response to GHK are way more youthful than the ones that are without GHK. We know that GHK declines with age. So where we may have a 200 level when we're in our 20s, we might have a 20 or a 60 level when we're in our 50s and 60s. So replacing that GHK can really help your cells in general to stay younger. A lot of the places that we'll use that is in pain syndromes, arthritis. We'll see this. I had a patient with avascular necrosis of the hip, which is sort of an early age osteoarthritis, arthritic change. It's due to some different things of the hip joint and almost always requires hip replacement. And one of the things we used to treat her was GHK-Cu, and she was able to go back to sport without having a hip replacement. So that was really exciting to participate in her care. But GHK-Cu can be really great as a topical as well. And that's where we're seeing a lot of companies come out with topical skincare lines that have GHK-Cu as their primary active ingredient, and then using it in combination with some other great skincare products. This can really help with that crepey skin, the fine lines and wrinkles. And then, as you suggest, helping the cells to recover. So rather than laying down a scar, it lays down a way more beautiful, almost like regular skin. So your scarring is way diminished if you're using that GHK on a regular basis. So we recommend for hair loss as well. There's some really interesting research using GHK with hair loss. Because the copper can burn, I usually will use the GHK alone when I'm doing hair restoration procedures with PRP or stem cells or exosomes. We'll use the GHK by itself and have the patient take copper by mouth. The thickness of the hair follicle is increased. The number of hair follicles are increased. So it's very exciting to use that and see those results in patients. We'll actually have them use Vitale skincare. They have a lovely 3% serum, and we'll have them roll their scalp and then put that serum on in the interim between treatments for scalp hair restoration.
Oh, amazing. Yeah. I didn't even think about the hair, but I heard you talk about that as well. So there's hair, skin, and nails. Is it also good for the nails?
Right. So
Yeah.
apply it when you put it on your face, then you apply it to the follicles, to the nail beds yeah.
So when you're looking for a GHK-Cu, let's say serum or cream, I'm not sure how it comes. Is there a certain percentage that you want to be looking out for of how much copper or GHK-Cu is actually in there?
Between 2 and 3% is typical. You can get a GHK booster, I believe, that brings that. So I think Picard's company, he's the original researcher in GHK.
Mm-hmm.
He has a boost that when you add it to his regular serum, it brings it up to 3%. So 2 to 3% is the typical effective dose. It's what all the research has been done is using that 2 to 3%. It does cross. So we recommend that you do a cleanser that has some sort of exfoliating properties, either a chemical or mechanical exfoliation. And that can be with little sand or little pieces of walnut shell, or you can use a washcloth itself, can be effective. And then you apply the cream. It's super helpful after you have cosmetic procedures, so microneedling, et cetera. Using that GHK afterward can help with scar formation, diminishing that effect of the treatment itself. So that would be another way we would use it, in addition to a scar like yours that you're getting ready to experience, and applying that. So I like that 3% Vitale skincare, their scar treatment. It's recommended just as a serum, but it's great for the scalp. It's great for scar formation. It's great for post-aesthetic procedures.
Oh, okay. So there's the brand called Vitale, but is that in Europe as well, or just the US?
I'm sure they deliver to Europe as well.
Interesting. Cool. Oh, wow. So lots of things I can keep talking to you about, but we're going to have to wrap it up. I have so many other questions now about hormones and hormone therapy, but I think we're going to save that for another episode because I really want to talk about a little bit about your book, which I didn't even know because we decided on this podcast so last minute because I normally read the books of all my guests. And then it's called Counterclockwise, using peptides to renew, rejuvenate, and rediscover. Tell us a little bit more about that. And is this a new book? Is this, I mean, I'm kind of new on the territory.
Sure, I will send you a copy. It came out just in March. And the idea for me was to provide a way for my patients as well as other doctors to be able to communicate to their patients about peptides. So it's designed to be read cover to cover, but you can just read the chapter that applies to you. You don't have to read all the chapters. So it is sort of a reference book. There is a high level discussion in the beginning with a patient case or vignette that explains why I might do what I would do in what kind of patients this might apply. But there also is a deeper dive in every chapter that allows you to get a little bit more education. And then you certainly can, in the end of the chapter, there are lots of references that explain what the particular peptide does and what the research shows on that particular peptide. So the idea for me was both to have patients be able to read it, but also for all the providers who are not well versed in peptides to be able to take this book and use it as a guide for, oh, this is either how I talk to patients about using peptides, or it would be a launching point to begin to learn about peptides.
Fabulous. I got to get, okay, this will be my reference book because I don't have a reference book on peptide. And I do have a lot of questions on it. So thank you so much. I look forward to reading that. And we're going to add some questions on top of the hormones again when we re-meet. But I'm going to have links to that book itself in the show notes. I'll have links to how to find you on Instagram and YouTube. It's well, different Dr. S. Ferre for Instagram, and then Dr. Cellular Medicine on YouTube. And I'll have a couple of the more notes that we talked about. And before I let you go, do you have any last words for a woman going through the menopause transition?
I think one of the things that's super important is to remember that when you are denying yourself self-care, you are actually being selfish, because we bring to the world beauty, creativity, nurturing, love. And if you are not doing the things that allow you to be beauty, creativity, nurturing, and love, you are denying the world what it needs from you. So if that requires you to take an hour and go get a massage, or take a day and go take care of yourself at a spa, or whatever the thing is, spending time with girlfriends, whatever it is for you, if you're every day pursuing taking care of everyone else instead of yourself, you're only denying them exactly what they need from you, which is those things: being beautiful, being nurturing, being loving.
Oh, I love those words. Thank you so much, Dr. Ferre. And I look forward to having you again next time.
Thank you, Zora. So nice to meet you. It's a pleasure.